We all know how important it is to take care of our health, but sometimes we might overlook certain areas, like maybe we don't always prioritize our oral health as much as we should.
Yeah, I think that's pretty common.
I mean, we brush our teeth, we go to the dentist when we have to, but do we really grasp the bigger picture, the global impact of oral health?
Right. It's easy to think of it as just a personal thing, but when you zoom out, the numbers are pretty eye-opening. We're talking about billions of people affected by oral diseases worldwide.
Billions. It's almost hard to wrap your head around that, right? And the crazy part is, so many of these issues are preventable.
Absolutely. That's what makes this so important to talk about.
So in this deep dive, we're taking a look at this global burden of oral diseases. We're drawing on some really fascinating sources, including some very recent data like the Global Burden of Disease study from 2021. And one of the most surprising things we came across,
What's that?
are you ready for this? The most common health condition globally is actually untreated tooth decay in permanent teeth.
Wow, that's pretty significant.
I know, right? It really puts things in perspective. It's not some rare disease. It's something affecting a huge chunk of the population.
And it speaks to the fact that access to even basic dental care is a challenge for a lot of people around the world.
Exactly. It's not just about knowing how to brush your teeth. It's about having the resources and the systems in place to actually prevent and treat these issues. And that often comes down to cost, which is another layer to this whole thing.
Yeah, I mean, dental care can be expensive, right?
Mhm.
And in many places, it's not covered by universal health coverage. So what starts as a simple cavity can actually snowball into a pretty serious financial burden for families.
Seems like a ripple effect, right? It impacts not just your health, but your whole life. So we wanted to unpack this for you to explore what's driving this global oral health crisis. And our sources point to some pretty familiar culprits, things like too much sugar in our diets, tobacco use, alcohol consumption, and maybe not always having the best oral hygiene habits.
Right, those are all key factors.
But there's also a deeper layer here. We need to consider the societal and commercial forces at play, the things that shape our choices and our access to care.
Exactly. It's about looking beyond the individual and understanding the broader context.
So let's dive into the specifics. When we talk about the big picture of oral diseases, what are the main conditions we're talking about?
Well, there's a whole spectrum of issues, but the most common ones are dental caries, which is basically tooth decay, periodontal diseases, which affect your gums, tooth loss, also known as edentulosum, and then, of course, there are oral cancers.
So it's not just about cavities, it's a whole range of problems. And you mentioned that these conditions are actually becoming more prevalent globally. What's driving that increase?
There are a lot of factors, and they all kind of intertwine. One major trend is urbanization. As more people move to cities, we see changes in lifestyles, diets, and access to traditional food sources. That can have a big impact on oral health.
So our changing world is playing a role. What else?
Well, inadequate exposure to fluoride is a major factor. Fluoride, as you know, helps strengthen tooth enamel and prevent decay. But in many parts of the world, people don't get enough fluoride, either through their water supply or through dental products.
I see. So even something as simple as fluoride can have a huge impact.
Absolutely. And then there's the availability of sugary foods and drinks. They become so cheap and easily accessible, which contributes to tooth decay, especially in areas where people might not have the best awareness of the risks.
That makes sense. We're bombarded with sugary treats everywhere we go.
And finally, and this is really important, we have to talk about access to care. For millions, even billions of people around the world, getting basic dental checkups and treatment is simply not an option. They might not have dentists in their communities, or the cost might be prohibitive.
You also mentioned the role of marketing, especially when it comes to unhealthy products. How does that factor into the equation?
It's a huge factor. I mean, think about the way sugary drinks and snacks are marketed, especially to kids.
Yeah, they make it seem so fun and appealing.
Exactly. And the same goes for tobacco and alcohol products. They're often advertised in ways that downplay the health risks, including the risks to your oral health.
So it's not just about individual choices, it's about the environment that shapes those choices. Okay, let's break down some of these conditions in more detail. We've all heard of tooth decay, but it's kind of mind-blowing that it's the most prevalent health problem globally. How does it actually happen?
Well, it all starts with plaque, that sticky film that builds up on your teeth. You know, you can feel it if you run your tongue over your teeth.
Yeah, I know the feeling.
So when we consume sugars, especially what are called free sugars, which include all the added sugars in processed foods and drinks, as well as sugars naturally present in honey, syrups, and fruit juices.
So it's not just the obvious sugary stuff.
Right. So when we consume these sugars, the bacteria in plaque feed on them, and they produce acid as a byproduct. And over time, that acid starts to demineralize your tooth enamel, creating those little holes we call cavities.
So it's like a mini acid attack happening in our mouths. And it sounds pretty unpleasant, but what are the real consequences if tooth decay is left untreated?
Well, it can lead to a lot of pain, obviously.
Yeah,
And it can make it difficult to eat properly, which can then impact your overall nutrition.
that makes sense.
And eventually you can lose the tooth altogether.
Mhm.
But it doesn't stop there. The infection can actually spread from the tooth to other parts of your body, leading to more serious health problems.
Wow, so it's not something to take lightly. Okay, let's move on to gum disease or periodontal disease. What exactly is happening there?
So periodontal disease affects the tissues that support your teeth, your gums, and the bone underneath. The early stage is called gingivitis, and you might notice symptoms like bleeding gums, especially when you brush.
Yeah, I've definitely experienced that.
It's pretty common. You might also have swollen or tender gums or even bad breath. But if gingivitis isn't treated, it can progress to a more severe form called periodontitis.
And what happens in periodontitis?
Well, the gums start to pull away from the teeth, forming little pockets where more bacteria can accumulate. And the bone that supports the teeth starts to break down.
Oh, that doesn't sound good.
It's not. Your teeth can become loose, and you might even lose them. And the worst part is, a lot of people don't even realize they have periodontal disease until it's quite advanced.
So, how common is this severe form of gum disease globally?
It's more common than you might think. Estimates suggest that over 1 billion people worldwide have severe periodontal disease.
1 billion. That's a staggering number.
It is. And the main risk factors are pretty straightforward. Poor oral hygiene and tobacco use.
So, brushing and flossing regularly and avoiding smoking can make a big difference. Okay, so we've talked about tooth decay and gum disease. And you mentioned that edentulosum, or total tooth loss, is often the end result if those conditions aren't managed.
Right. While you can lose teeth due to trauma or accidents, most cases of complete tooth loss are the result of long-term, untreated dental caries and periodontal disease.
So it's like the final stage in a long process.
Exactly. And it's more common than you might think. Globally, almost 7% of adults over the age of 20 have lost all of their natural teeth. And for those 60 and older, that number jumps to a staggering 23%.
So almost a quarter of older adults are living without any natural teeth.
It's a significant issue,
Mhm.
and it has a huge impact on people's lives. It can affect their ability to eat, speak, and even socialize. It can impact their self-esteem and their overall quality of life.
It's a reminder that oral health is about so much more than just having a nice smile. It's about being able to function and live your life fully. Now let's talk about a more serious topic, oral cancer. It can be pretty scary, but what do we need to know about it?
Oral cancer is a term that encompasses cancers of the lips, the inside of the mouth, and the oropharynx, which is the part of your throat at the back of your mouth. And globally, it's the 13th most common cancer. In 2022 alone, there were nearly 390,000 new cases diagnosed and over 188,000 deaths from oral cancer.
So it's a significant problem.
Definitely. And it tends to be more common in men than in women and in older individuals. And unfortunately, it often has a worse prognosis for men.
Are there any specific things that increase the risk of developing oral cancer?
Yes, there are. The biggest risk factors are tobacco use in any form, excessive alcohol consumption, and the use of areca nut, which is common in some parts of Asia and the Pacific.
So those same lifestyle factors that we've been talking about.
Exactly. And there's another emerging risk factor, the human papillomavirus, or HPV. It's actually becoming increasingly linked to oral cancers, particularly in younger people in North America and Europe.
That's interesting. It shows how the landscape of risk factors can vary across different parts of the world. So we've covered the major conditions, but there are also injuries and other less common oral health issues, right?
Yes, there are. And one that's surprisingly prevalent is orodental trauma, which basically means injuries to your teeth and mouth.
I can imagine that's common, especially in kids.
It is. Globally, about 1 billion people are affected by orodental trauma, and that includes around 20% of children under the age of 12.
Wow, so it's a really widespread issue. What causes these injuries?
Lots of things. Sometimes it's something as simple as having misaligned teeth, which can make you more prone to biting your tongue or cheek. But there are also environmental factors like unsafe playgrounds, falls, sports injuries, and even violence.
So it's a combination of individual and environmental factors, just like with the other conditions we've discussed. And what are the consequences of these injuries?
Well, they can be pretty serious. Apart from the immediate pain and discomfort, they can sometimes lead to tooth loss. They can also affect facial development, especially in children, and they can have psychological and social consequences, especially if they involve disfigurement or difficulty speaking.
It's a reminder that oral health is intricately connected to our overall well-being and quality of life. Now, you mentioned a particularly severe condition earlier, NOMA. What can you tell us about that?
Noma is a devastating disease. It's a type of gangrene that affects the tissues of the face and mouth, and it primarily affects young, malnourished children living in extreme poverty.
So it's linked to poverty and poor living conditions.
Very much so. It often starts with a small sore on the gums, but it progresses very rapidly, destroying soft tissues and even bone. And it can be fatal. In fact, if it's not treated, the mortality rate is around 90%.
That's incredibly high.
It is a tragic condition. And even for those who survive, there can be severe, lasting consequences. The facial disfigurement caused by noma can make it difficult to eat, speak, and even breathe. And there's often a lot of social stigma associated with it.
It's a stark reminder of the deep inequalities that exist in the world and how those inequalities impact health. Is there anything that can be done to prevent or treat NOMA?
Yes, there is. Early detection and treatment are crucial. Simple interventions like improving hygiene, providing antibiotics, and addressing malnutrition can make a huge difference.
So it's about addressing the underlying causes of poverty and poor health. And finally, let's talk about cleft lip and palate. What are those conditions?
Cleft lip and palate are birth defects that affect the development of the lip and the roof of the mouth. They happen when the tissues that form these structures don't fuse together properly during pregnancy, and globally they occur in about 1 in every 1,000 to 1,500 births.
So they're relatively common birth defects.
They are. And while they can be caused by a variety of factors, including genetics, there are certain things that can increase the risk during pregnancy, like smoking, alcohol use, and poor nutrition.
Those same risk factors again.
Yes, they pop up again and again. But importantly, with timely surgery and comprehensive care, children born with cleft lip and palate can often have complete rehabilitation and lead healthy lives.
It's encouraging to know that there are effective treatments available. So as we've been discussing, there are many different oral health conditions, and they're all connected by these underlying risk factors and inequalities.
Absolutely. And it's important to remember that these risk factors are the same ones that contribute to other major health problems like heart disease, stroke, cancer, and diabetes.
So it's not just about your mouth, it's about your overall health.
Exactly. There are clear biological links as well. For example, there's a two-way relationship between diabetes and periodontal disease. Having diabetes can increase your risk of gum disease, and having gum disease can make it harder to manage your diabetes.
It's a vicious cycle.
It can be. And then there's the link between high sugar consumption and not only tooth decay, but also obesity and diabetes.
So it all comes back to those lifestyle choices.
And to the social determinants of health. Remember how we talked about the link between socioeconomic status and oral health? That's a really important piece of the puzzle.
Because it means that people who are already disadvantaged are more likely to experience these problems.
Exactly. And that's why it's so crucial to address those broader societal issues if we want to make real progress in improving global oral health.
So what can be done? What are some of the key strategies for tackling this global burden of oral diseases?
Well, first and foremost, prevention is key. And that means addressing those shared risk factors. We need to promote healthier diets, reduce tobacco and alcohol consumption, and encourage good oral hygiene habits from a young age.
So it's about education and awareness.
Absolutely. And it's about making healthy choices easier. For example, governments can implement policies like sugar taxes or restrictions on the marketing of unhealthy products.
That makes sense. And we also need to ensure that everyone has access to affordable dental care, right?
Definitely. That means investing in oral health infrastructure, especially in underserved communities. It means training more dentists and other oral health professionals. And it means exploring ways to reduce the cost of care, perhaps through subsidies or insurance schemes.
So it's a multi-pronged approach.
It has to be.
Yeah.
And it's encouraging to see that there's growing momentum at the global level. In 2021, the World Health Assembly passed a resolution on oral health, which calls for a more preventative approach. and for integrating oral health into primary healthcare systems.
So there's a recognition that oral health is essential to overall health.
Exactly. And there's also a global strategy on oral health, which includes an action plan for 2023 to 2030, outlining specific steps for countries to take to improve oral health for their populations.
So there's a roadmap for action.
Yes, there is. And just this year, the Bangkok Declaration on Oral Health was adopted, which really emphasizes the importance of prioritizing oral health as a global public health issue.
It's great to see that this issue is finally getting the attention it deserves.
It is. And I think there's a real opportunity here to make a significant difference in people's lives.
So to sum it all up for you, our listener, oral health is much more than just having a pretty smile. It's a fundamental aspect of overall health and well-being. And the good news is that many oral health problems are preventable.
That's the key takeaway.
And remember, untreated tooth decay, something we might consider pretty minor, is actually the most common health condition worldwide. It's a reminder that even small actions, like brushing and flossing regularly, can have a big impact.
And that access to care is crucial.
Absolutely. So as we wrap up, we want to leave you with a thought. What one small change could you make today to improve your own oral health, or perhaps to advocate for better access to care in your community or beyond? Maybe it's something as simple as scheduling a dental checkup, or maybe it's something bigger, like supporting policies that promote oral health. Every action counts. And remember, there's a wealth of information available from your local health organizations and the WHO website if you want to learn more. So let's all make oral health a priority for ourselves, for our communities, and for the world.